Thank you, Tony. Well, skin cancer is the most common type of cancer in the United States. And while summer may be behind us, protecting your skin is a year-round priority. Joining us this morning to share more about prevention and early detection is Dr. Melanie Palm, a board-certified dermatologist and cosmetic surgeon. Good morning, Dr. Palm. Good to see you again.
Good morning. Good to see you too, Allie.
I think a lot of times we remember in the summer, it's hot. We go, okay, we need to put on our sunscreen. A lot of times I think people make it part of their daily routine, but as we get into the cooler months, people don't think about it as much.
They don't, and I actually just finished writing a paper for a facial plastic surgery journal talking about men in skincare. And I started with the line, what's the TLDR on skincare in men? You know, what's the too long, didn't read? And only 17% of men actually use sunscreen on a daily basis. So I think especially, you know, I didn't grow up here, I'm a transplant, but I really try and practice what I preach. I want patients to enjoy San Diego. We're in an amazing place, but I think some simple rules of just keeping our skin protected, having sort of a daily ritual of sunscreen is really gonna protect us in the long run, regardless of your skin type, and we'll talk about that.
Yeah, and so normally I think to do it on my face, but where else? What else do you recommend?
So I think some of the debate, people get concerned about vitamin D, and the reality is a lot of us are actually sort of underserved. We're either insufficient or deficient, and so people think like, oh, I'll go out and I'll expose myself. We're in San Diego, I'll make some vitamin D myself, and that's really not the way we want to do it. The reality is you only need like 15 minutes 3 times a day in order to get your body to produce that, but most of us need supplementation. But you want to actually any sort of skin that is exposed, and you know, you think of your daily drive, going to the post office, running errands, that all adds up over our lifetime. So you want to make sure first thing in the morning you're applying sunscreen. It should be broadband, SPF 30 or more. We want to protect against UVA and UVB, and if you have like a day at the beach, seek shade, avoid peak hours, and you want to be protecting yourself and reapplying about every 90 minutes to 120 minutes.
Now we're showing some of the images on the screen, and this is important because I think especially as you get older, you may notice some of these pop up on your skin. When do you need to be concerned?
So I tell patients anything new or changing. I really think patients have a sixth sense about things, and I think one of the important things we can do as board certified dermatologists is listen to our patients. Most doctors, we interrupt people about 8 seconds into their story, but I have patients say, you know, something is new, something is funny, it just seems like the ugly duckling, something about it seems off, and that's something we should investigate. But in general, when we're thinking about something like melanoma, there's the A, B, C, D, E's. So A for asymmetry, B for an irregular border, C for colors, either that are unusual or multiple, D for diameter, so more than 4 millimeters, about a pencil eraser head, or E is evolution. I think that's the most important. That's new or changing. Something is different, it doesn't belong.
Okay, and any other tips that you have for people, like I said, where we're not thinking about it as much? What do you tell them? Wear a hat? What is it for you that you're like, make sure you're doing this?
Well, normally I'm hiking Torrey Pines right now, so I think doing things in the early morning or dusk, try not to do it when the sun is overhead. Make sure you got a wide brimmed hat. There's amazing sort of choices in terms of UPF clothing, so keep your skin covered in that way. And then make sure that you're selecting a zinc or titanium based sunscreen, one that's mineral based, and even indoors, wearing a tint, so iron oxides and the tinted sunscreens help against pigmentation. So the visible light we're in right now, the blue light that are coming off the devices that we're surrounded by, they can cause pigmentation over time. So there's even a reason to wear sunscreen indoors.
Oh, that is such a great tip. And obviously, like I said, even though we're heading out of summer, it's a great topic to keep top of mind for people because we do live in beautiful, sunny San Diego.
We do. We're very fortunate, but protect yourself while you're out there.
All right, Dr. Melanie Palm, great to see you. Thanks for coming in.
Thank you.
All right.